My name is Matthew Jimenez. My specialty is orthopedic surgery. The type of patients I see are patients in need of hip and knee replacement and shoulder replacement. I also see a lot of patients with significant traumas and fractures. So, in essence, my specialty not only is orthopedic surgery, but the subspecialty is joint reconstruction, complex traumas, and then in the joint reconstruction arena, it's hip and knee replacement and shoulder replacement. And the thing I'm most excited about in the last year or two is the minimally invasive techniques, primarily for hip replacement, and that would be the direct anterior approach to the hip. When patients come into my practice at Illinois Bone and Joint Institute, they'll see a team approach. I have a very cohesive and friendly and open team, and we're well coordinated, and they have the same philosophy that I do, and that is to understand the patient's goals and how a patient sees themselves in context of their health and their quality of life. I want to make sure a patient is educated regarding their issue, and I want to understand what their goals are so that I can meet their goals. So I spend a lot of time talking to the patient and answering their questions and understanding what their particular needs are.